And we are back with another episode in our series on frozen embryo transfers. We are going to be talking about the actual procedure. We're going to be answering some frequently asked questions today. If you'd like to hear more about frozen embryo transfers, check out part 1, which was episode 68 of our podcast. If you want to hear about fresh embryo transfers, check out episodes 67 and episode 80. And of course, if you want to hear more about IVF, check out episodes 14, 20, 54, and 58.
All right, so let's talk about what an embryo transfer is like, specifically at Markham Fertility Center. So picture this is transfer day and you're a Markham Fertility Center patient. Congratulations, you've made it to embryo transfer day. This is a very exciting step and it's totally normal to feel a mix of emotions like hopes, nerves, maybe a little bit or a lot of anxiety. So let's walk through the process of getting an embryo transfer MFC so that you feel as calm and prepared as possible.
First of all, you are going to get instructions ahead of time. Once the embryo transfer is booked, those instructions are posted on the portal. In those instructions, there's going to be things like advice around arriving with a comfortably full bladder. This really helps us get the best ultrasound view of the uterus and the lining so we can put the embryo in the best spot possible. Now, bladder filling, how to fill the bladder, what's a comfortably full bladder. This always leads to a lot of confusion and anxiety. So let's talk about that. We suggest drinking 1 liter of water about an hour prior to your scheduled transfer time. That being said, everyone's bladder is totally different. So your bladder size might be different. Your baseline level of hydration might be different. And so if you find that you're too full and that you feel like you're going to burst or you're really uncomfortable or you're starting to cramp, please use the washroom and let out a little bit of urine. We want you feeling full, but comfortably full. That is the ideal sweet spot when it comes to filling the bladder.
Another thing that's important to remember is to please avoid using things like perfumes or scented lotions. The embryos can be really sensitive to scent. So we do have a perfume free environment for that reason. Also, take your medications as instructed. Like I mentioned, follow your protocol, especially estrogen and progesterone if you're doing a medicated cycle.
When you arrive at the clinic, you're going to check in with the concierge at the front desk. We're going to confirm your identity. So please bring 2 pieces of photo ID because, of course, we want to make sure that we're putting the right embryos into the right person. From there, we're going to have you take a seat in our waiting room. Now, pro tip, don't drink coffee. Coffee is a bladder irritant and it'll just increase your urge to pee. So this might not be a day where you're drinking multiple cups of coffee. You're going to be in the waiting room and the doctor performing the procedure is going to pick you up there. They're going to go over the plan for the day and again, confirm your identity along with details about the embryo that we're transferring. Your partner or your support person can be with you every step of the way.
The actual procedure itself happens in the procedure room, which is actually the same room where we do the egg retrievals. We're going to get you into that room. Both you and your partner can come together, or anybody that you want to be with you at the time of the embryo transfer. And we're going to get you into a special private space where you can change, removing your bottoms and covering with a blanket so that we can do the transfer procedure. In the embryo transfer room, there's going to be yourself, your support person, the physician doing the embryo transfer, as well as the ultrasonographer who is going to help us check the position of the bladder and the exact position within the uterus to transfer the embryo. The embryologist is also going to be present, but not specifically inside the room. They're going to be through a window that they're going to pass the embryo in when it's time to do the embryo transfer. Now, before we do anything, we do check the name again. And in addition to checking the names, we're also going over again the type of embryo that is being transferred, as well as checking your IDs, like I mentioned.
The ultrasound tech who's in the room is going to be doing an abdominal ultrasound, meaning that there's going to be an ultrasound probe on top of your tummy to help guide the physician. The physician is going to use a speculum, just like if you're having a pap test or a pap smear, to allow us to visualize the cervix. And then we place a very soft, thin catheter through the cervix. Very important to point out this is not like a sonohistogram. Even though we say both times, okay, we're putting a catheter through the cervix into the uterus, this feels very, very different for the vast majority of patients. So, this is not like the experience of a sono. For the vast majority of patients who are undergoing an embryo transfer, this really feels like a pap test with a full bladder and with that probe just on top of your stomach.
Once the catheter is in perfect position, the embryologist is going to do the final preparation steps. This is when the embryo gets loaded into the catheter and it gets handed off to the physician. And we do another ID check at that point. The embryo at this point is gently placed into the uterus. It is completely painless for most people, and no anesthesia or recovery is needed. The entire procedure only takes a few minutes, and this is the time when the physician and the ultrasonographer are communicating so that the embryo can be positioned at exactly the right place in the uterus. This is also the time where you might feel extra pressure coming from the ultrasonographer. And this is because they really want to show us the perfect place to position your embryo.
Now, you might see the embryo actually being transferred on the ultrasound screen. It looks like a little flash of light. Sometimes it's described as a shooting star. For sure, that's one of our favorite parts of our job, without a doubt. After that, we take the catheter out of the uterus and we hand it back to the embryologist. And they always double check to make sure the embryo actually left the catheter and didn't, let's say, get stuck to the wall of the catheter. This can happen about 2% of the time. If it does, we do the same process and put the embryo back into the uterus and try again. If the embryo has left the catheter, we take the speculum out and we have you lie down for about 5 minutes on the procedure bed. From there, you can get dressed and you can pee and empty completely. So many people describe this as the best pee of their life. Do not worry about peeing. You absolutely cannot pee the embryo out. So you can pee freely.
Once this is all done and you're now ready and comfortable, you can visit the nurses again to review your instructions before you head home. Most people go back to normal activities the same day. There is no need for a strict bed rest. Just take it easy and be super kind and super loving to yourself. We'll schedule your pregnancy tests, which is a blood test of the HCG level, about 2 weeks after the embryo transfer. Embryo transfer day is often described as one of the most meaningful moments of the IVF journey. It is okay to feel emotional. We know that it matters and it means so much to you to get to this moment.
Frozen embryo transfers are such an incredible tool in fertility care and have made such a difference in the world of fertility and pregnancy outcomes. And we have so many different protocols and different types of progesterone in our toolbox. And this gives us a lot of flexibility to meet people where they are.
There is a lot of science behind it. Like Dr. Weiss mentioned, the science of vitrification, which is how you freeze and thaw an embryo, has come a long way. However, despite all the science, there is still a deeply personal and for many people, a spiritual experience. We want our patients to understand their options and feel like they're partners in the process. We're deciding together.
If you're someone who is considering a frozen transfer or is gearing up for an embryo transfer, feel free to talk to your care team about the pros and cons of each protocol and progesterone. And of course, do not hesitate to ask questions because we're always here for that. So, let's talk about some of the frequently asked questions that we get a lot, and let's address these things.
One of the question is one method better than the other?
So I think we've spent a lot of time talking about this, but the bottom line is that there is no particular perfect embryo transfer method. Although, we've presented some research that seems to suggest that a natural cycle, or maybe a stimulated cycle is better, it doesn't necessarily mean that it's better for you. Success rates can be really similar across protocols when they're used appropriately in the correct patient. What matters more is matching the approach to the individual. Now, here's a question for you, Dr. G. Do I need bed rest after a transfer?
The answer to that is no, you do not need bed rest. This has actually been studied, and there is no evidence to suggest that a strict bed rest after an embryo transfer improves pregnancy rate. I normally recommend our patients take it easy that day. So that means they can do light activity like go for walks, go to a restaurant, do some cooking, maybe work on their projects on the computer and things like that. The uterus doesn't eject the embryos with movement, so you can do the regular activities that you normally do during the day. I just wouldn't do anything above and beyond that. So here's another question for you, Dr. Weiss. Is progesterone always needed?
I think we've done a lot of talking about that in this episode, but the short answer is yes.
Yes.
In a medicated cycle and stimulated cycles, for sure, most definitely. In a natural cycle as well, there's great evidence to show that even though your body is making progesterone, giving extra progesterone does seem to improve outcomes as well. Basically, if you're doing a frozen embryo transfer, we're going to be giving you some type of progesterone. Now, here's a big question that we get a lot. What can I do to increase my odds of the embryo sticking, of the embryo transfer working?
Yeah, you're right. That's one of the most common questions we get, and with good reason. I would say follow your protocol. Your protocol was put together for a reason. It took into account your individual medical history and the experience and expertise of your fertility doctor. This would be a time where it's very tempting to listen to social media reels or Dr. Google or the newcomer to the noise in the fertility world, which is Chat GPT, and then get frustrated and confused and trying to change things. But I really don't recommend that. Follow the protocol as it was prescribed for you. And if you have questions, don't hesitate to ask your fertility team, but again, the protocol was put together for a reason, and the more that you can follow it the way that it was prescribed, the higher your chances of pregnancy will be. It's also important to aim for a healthy lifestyle. After the embryo transfer, we always think of patients as pregnant until proven otherwise. So that means a healthy lifestyle in terms of diet, sleep, and movement, and no alcohol, no smoking, and avoid any recreational drugs. Part of a healthy lifestyle is also taking your prenatal vitamins, your vitamin D, and your omega 3. This doesn't make the embryo stick per se, but it can lead to a healthy pregnancy once the embryo does implant. And if you want to hear more about that, check out episode 10, where we do a deep dive into prenatal vitamins and other supplements that are important for a developing pregnancy.
All right, Dr. Garcia, that was a great answer, evidence based. Loved it. But here's my question for you. What is the advice that you give to patients that is not evidence based? I want to hear the most unhinged, out there thing that you tell patients about, improving the odds of an embryo sticking or what they should do after an embryo transfer, because I'm sure you've got something in mind or you say something. And for those of you who are interested in hearing about the mythology around things to do after, let's say, an embryo transfer, you can check out episode 40 of this podcast where we talk all about the pineapple. Again, not evidence based. I don't want the evidence based answer. I want the crazy, unhinged answer.
Well, now you're poking the bear, okay? Right after the embryo transfer, we have the dreaded 2-week wait. And that could be a whole episode onto its own about, what that means and what is happening to your body that time and what are the emotions that that can bring. So I think the day of the embryo transfer itself, like I said, you do not have to be on bed rest, but I normally recommend that patients take the day off if they can and do something that brings them joy. That could be watch a funny movie, not a sad movie, a funny
Uh-huh.
movie, maybe go for a walk if the weather is nice, maybe visit a friend, good supportive friend, not the one that's going to drive you crazy with unsolicited advice. Some retail therapy that would work for me for sure. And then during the 2-week wait, I mean, everybody does this differently, but I really feel that it's important to acknowledge your emotions and process them, not to push them down and ignore them, because that's usually not a recipe for success. So acknowledging emotions and processing can look different for everyone. For me, I love writing and journaling, but not everybody has to do that. Other people prefer light movement. Other people prefer meditation, maybe having your appointment set up with the therapist if you're working with one. But anything that you can do to honor the moment, this is a big moment on your fertility journey, and honor the embryo that has been put in your body and develop a bit of a trust in your body and trust with yourself and trust in the future that you're trying to work towards. Not evidence based. You said unhinged, so I went unhinged.
I don't think that's not unhinged. No. I have to say that I will tell people there is a certain mythology out there about McDonald's French fries on the day of the embryo transfer. Again, very much not evidence based. But I always tell people, like, hey, do you like McDonald's? Do you like McDonald's French fries? And if they say yes, I say, you should go get McDonald's French fries. They go out
I
to
love
McDonald's.
McDonald's French fries. Can the theory
They're
be that
so good.
the doctor doing the transfer has to have McDonald's French fries because I'll sign up for that.
There's something about them. They're so good. Again, not evidence based. I'm going to say that again. But I think it kind of speaks to the fact that, you do something that is good for your mental health. You do something that makes you happy. If it is McDonald's French fries or McDonald's, like, go for it. Like, you deserve that treat. And then I will often also recommend a funny movie. I give specific movie recommendations because I look for movies that have absolutely zero mention of any pregnancy, fertility, childbearing, anything along those lines, and movies where there are sequels because you need something to do on night 2, right? So the day after the transfer as well. I have to say some of my go-tos that I have recommended to patients before, 21 Jump Street. It's silly, it's not intellectual at all. I will admit I'm a huge Channing Tatum fan. So that's one that I've definitely recommended to patients before. And as of last time I looked on Netflix, it was on Netflix. So there you go. And there's a sequel to watch the following day.
When I was doing my embryo transfers, my go-to were reruns of Friends. I felt like that was safe. I love that show. I could still watch it like nonstop. So that was my go-to when I was doing embryo transfers.
That is a fantastic show. And definitely for all the millennials out there who are listening to this, they are going to appreciate that suggestion. So, we've covered a lot of ground today, and we've talked a lot about frozen embryo transfers, including the procedure and exactly what it looks like at Markham Fertility Center, with the hopes that if you hear about all the details, it can help you visualize what it's like so that you're going into it with a little bit less stress and a little bit less anxiety. And that's a wrap for today, Superhumans.
If you're looking to connect, get social with us. Follow us on YouTube and Instagram at My Fertility Podcast or visit us online at markandfertility.com. And don't forget, follow, subscribe, and share your favorite episode.
Thanks for listening to My Fertility Podcast and for being a vital part of our community. We know you've got this.
We're signing off until next Tuesday.
If you found this episode of My Fertility Podcast helpful, please take a moment to head over to the review section and leave us your thoughts. Your reviews and comments are incredibly valuable to us and help guide future episodes. We also welcome you to direct your questions to info@myfertilitypodcast.com.
My Fertility Podcast is produced by Rabbit Media Inc. in conjunction with Dr. Garcia and Dr. Weiss.
Music from Mixkit, Life is a Dream by Michael Ramir C.
My Fertility Podcast is not intended to replace any type or variation thereof professional medical, health, or legal advice, nor should the content be taken as medical advice. Please contact your primary healthcare professional regarding any medical questions you may have. The information presented in this podcast is based on the knowledge and understanding of the host at the time of recording. Medical knowledge is constantly evolving, and new research may change the understanding of health-related topics. While we strive to provide accurate and up-to-date information, we do not guarantee the completeness, accuracy, or timeliness of the content. The views expressed in this podcast by guests are not those of the host or the management. This podcast is not intended to impose any type of discrimination. My Fertility Podcast and its management are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast.